And I think that is one of the main reasons why we don't have insurance companies covering up, because as you showed in your slide, there are clinics which have more than 50% consistent results, and there are most of the clinics which have less than 30% pregnancy rates or implantation rates. The economics doesn't really work by 100% money back. But how do you prevent the patient from being exploited? So I also feel that if we are, accountable on that front, and if we are able to refund some amount if you are not, successful after 3 or 4 cycles, does it help?
I think this is a very important point, especially in private practice in a metropolitan city, where most of the patients, at least 50% of my patients at least, are browsing the net before coming to us. And they have these various options. So with time, we are noticing, sadly, that instead of medical consultation, 50% of our time is sometimes devoted in financial consultation. And they will not hear it from anybody else. They will just hear it from the chief clinician. So it's very sad but true. And how do we address that? We were discussing a surrogacy package, and once I said my coordinator would explain the rest of the package to you. If there are any other medical questions, I'll be very happy to answer. They said, no, we've just come from the next clinic next door. They said 5 lakhs and baby. How come you're not doing it? Is that center better than yours? I said, well, IVF, in my opinion, does not work that way. We may get it the first time, we may not get it, we may need to use an egg donor, we may need to go to surrogacy. So we are not giving any guarantees, and we are not doing money back. So it is for you to decide which one to choose and which one not to choose. So I think, yes, we are in a very complex world, and the patient's choices and decision makings are becoming more and more difficult.
See, what is important is, as we are going a little deep into the discussion, I'm also realizing, and I'm sure all of you also realizing, like a money back guarantee or any kind of an insurance cover is probably not going to work. So ultimately the onus comes on the patient. Yeah, Kaveri?
I think like any other illness which is covered at a premium, infertility should also be given that option. We cannot withdraw that option. How much premium, at what, what should be the screening test, etc. should be decided. But we cannot close the door of insurance to infertile couples.